Namaste, welcome back to my channel. Today let us have a discussion on vulnerable policy. So what is vulnerable policy? How to take care of a vulnerable patients in a hospital. So there is a small discussion on vulnerable policy. So overall comes under a vulnerable group in the sense age below 15 years and above 65 years group, and those who cannot able to do their daily living activities, they are all comes under vulnerable group. So definition of vulnerable patient: a patient who is or may be for any reason unable to protect and take care of him or herself against significant harm or exploitation. In the sense, those who cannot able to do their daily living activities, in the sense due to some disease condition or some other reason they couldn't able to do their daily living activities, those are all comes under vulnerable group. Purpose of this policy is to provide guidelines instruction in order to ensure a safe environment for vulnerable patients. In the sense, those who are coming in a vulnerable group, so our intention is to provide a safe environment for them, to identify the groups of patients who shall be considered vulnerable. So then and there, when patient comes to the hospital, we should identify the patient overall comes under vulnerable, so that we can able to provide the proper care to them. To define a mechanism of assessment and management of the vulnerable patients. So as soon as the patient enters to the hospital, we should have a proper assessment of the patients. So during assessment itself, we can come to know patient comes under vulnerable group or not. Following types of patient can be identified as vulnerable: patient who are old, like age above 65 year or a certain age as decided by the hospital. And second one is patient who are of minor age, patients below 12 year are as decided by the hospital. And the patients with physical problems such as limited mobility, blindness, deafness, speech limitations, etc. And patients with mental problems such as depression, mental retardation, forgetfulness, etc. And patients with who are unconscious or in semi-conscious stage. And also patient who are all illiterate and have difficulty in understanding written instructions. So these are all the patients comes under vulnerable group. Vulnerable patients are prone to face following problem during their stay in the hospital: fall from bed or in washroom or while transporting from one place to another. So these vulnerable patients may get fall during shifting from one place to another place, or if they go for washroom there is a chances of fall. And the physical and mental limitation makes it difficult for these patients to avoid falls. Harm due to medical error such as wrong medications, wrong diet, etc., as they are unable to be watchful about the care being given to them. Neglect or abuse, verbal or physical, and similar other behaviors by some staff. So they may get neglect from or physical or mental abuse from the healthcare worker. Infringement of their rights such as privacy, informed consent, confidentiality, respect, etc. Acquiring of healthcare associated infection, as these patients may not be observant about infections prevention practices. And what are all the precautions should be taken for the vulnerable patient? Vulnerable patients shall not be left alone at any given time. And female patient and children of both genders shall be attended for their physical interventions such as bathing, and toilet by a female attendant. All minors shall only be admitted along with an attendant approved by the family, except in ICU. Special requests made by the patient family shall be respected. Regular monitoring shall be ensured by supervisory staff to ensure the safety and security of vulnerable patients. So these are all the precautions should be taken for the vulnerable patient. They should not be left alone because they may have a fall. So always bystander should be there, and while attending a female patient and female attendant should be available, and whenever the minor like children's admitted, there should be a bystander with the patient. And pediatric patients, bed and crib side rails shall be remain up, the bed left in lowest possible position when patient is not under direct care of nurse or attendant. So always providing of a bed crib or side rails is very important for the pediatric cases, again to prevent fall. Accommodation for patients at bedside shall be made whenever practical. Pillows shall be firm and offer support. Light plastic wrappings are not permitted on sheets and pillows. Children receiving heat treatment of any kind shall be kept under close supervision. Baby scales shall be placed safely on a table top so that should the infant fall, baby would not land on the floor. So these are all the precautions should be taken for the pediatric cases. No child should be left unsupervised while he or she is eating. Food shall be soft and age specific. Small candies and toys shall not be accessible to a small child lest she choke or insert them in a body orifice. When a small children has finished eating his or feeding, equipment shall be removed and he or she shall be returned to his or crib immediately. Medication shall not be left on the bedside. Wheelchair accessibility is possible within the hospital for children, disabled and elderly patients. Wherever possible, arrangement is made for bedside accommodation of bystander. Signage boards with contrasting colors, large font in English as well as the regional language are placed to help senior citizens. In registration counter, senior citizens physically handicapped are given priority. This is very important. Senior citizens should have a priority. Proper wheelchair accessibility and proper signaging in the hospital, and also priority should be given for the senior person during registration is very important.